On the mortality rate front. Now, it may not be high as originally thought. We talked about that denominator. The bigger the denominator gets of people who are tested, the more information we're finding out about the true mortality numbers. So a little over 3 weeks ago, the World Health Organization initially pegged the Wuhan virus's fatality rate at 3.4%. That is a staggering number. And that means, again, the total number of deaths divided by the total number of people who tested positive. Now, it varies by country, and it depends how many people are tested, though. Well, in the United States, right now, it stands at about 1.4% mortality rate, and we're still ramping up testing, although testing is sky high now compared, of course, to the way it was just a few weeks ago. In Germany, where they've been testing 500,000 people a week, if you can believe it, the mortality rate is 0.5%. Now, it's critical to remember the WHO's figure leaves out, doesn't include people with minimal symptoms or who are asymptomatic. That means they didn't have any symptoms at all and just walked around undiagnosed. So figuring out that number is crucial to determining how deadly the coronavirus really is. So what do scientists think here? Well, this is from Dr. Fauci, who wrote last month, if one assumes that the number of asymptomatic or minimally symptomatic cases is several times as high as the number of reported cases, the case fatality rate may be considerably less than 1%, and COVID-19 may ultimately be more akin to those of the severe seasonal influenza pandemic. Well, the seasonal flu's mortality rate is just 0.1%. So again, we've gone from possibly 3.4%, which is millions dying, to perhaps closer to 0.1%. See why it's important to let the data come in? Even CNN's Dr. Sanjay Gupta had to admit today that as bad as things can get, and they're getting pretty bad, especially in New York and some of these other hot spots, we do need to keep our perspective here.
The vast majority of people, even if you're elderly, aren't going to need hospitalization. The vast majority are going to recover. The vast majority are not going to die. So you're still significantly more likely to get through this than not.
Now, finally, the president dismissed the idea that he should just be in the White House hunkering down, meeting with his team, and not visit those who at this point, given everything they're doing for us, could actually use a morale boost.